My name is Paul Collop. I've been a substance use clinician for the past almost 10 years, and I recently got my master's in clinical mental health counseling and my licensed professional counselor candidate licensure. I've been working with people struggling with addiction, primarily focused on the mental health aspect of trying to understand where is this addiction coming from. And kind of in my experience, that tends to come from attachment traumas. And so I tend to focus a lot on healing some of those past hurts that kind of add fuel to the fire of the addiction, as well as at the same time helping people to be able to have tools and skills to prevent relapse as we're doing our work. Some special things about me, I really enjoy things like hiking and being outdoors, doing that kind of stuff. Swimming's kind of my favorite thing. But I also enjoy some of the nerdier aspects of life. I love playing board games. I play a lot of tabletop RPGs, and I'm actually working towards getting specialized in tabletop therapy to utilize things like Dungeons and Dragons and things like that as a therapeutic tool for my clients. The biggest coping skill I would suggest is learning to utilize the breath. To steal from John Kabat-Zinn a little bit, the breath is purely of this moment. It doesn't have any of our past hurts. It doesn't have any of our traumas. And it is the best grounding skill that we have because this breath is purely of right now. And when we can learn to just be with the breath and to learn to just experience the breath as it is, it becomes one of the greatest self-soothing strategies we have. A couple other really good ones that I've found have been really helpful, kind of in different aspects of learning to manage trauma, is learning to get comfortable in our bodies. And part of that process is through things like progressive muscle relaxation or progressive muscle mindfulness. Learning to kind of get comfortable with the experience of being in our body, as so often trauma pulls us away from being able to experience our lived internal body experience. The biggest thing is learning how to have one foot in the now and learning how to still be in that experience without avoiding or trying to get rid of it in this kind of modulated here and there kind of experience. When we can achieve that, that's when we can start to move forward and staying grounded and connected rather than getting completely lost in that trauma. Yeah, particularly with trauma survivors, when these big events happen or the current election cycle or any of these things start to occur, for people with trauma, a lot of the times we learned our bodies aren't safe with what we've experienced or what we've been through. And we develop this chronic stress response in our bodies. We're constantly tense, this feeling of being able to not speak or to have to hold this experience so tightly. And with these things as they're occurring, it can kick up that chronic stress response. It can add more to it. And if we're already not feeling safe in our bodies, having these things of hurricanes, tornadoes, natural disasters, all these kinds of things, the political conflict in Ukraine, all this kind of stuff can really just add to that stress, making us feel less and less safe in our bodies, making us feel like more and more the world is unsafe, which just adds to that response. One of the best things you can do if these current events, hurricanes, natural disasters, political stuff, if this is really starting to affect you, is one, kind of developing some boundaries around how much you're exposing yourself to these experiences, because if you can modulate how often this is happening, that's kind of the best approach. But in terms of how to cope when you're not able to avoid it, using the breath, learning to recognize within yourself, what does it feel like when you start to get activated? And what does it start to feel like when you're noticing that overwhelm? Overwhelm is the biggest enemy of trauma survivors because overwhelm is what leads us to be re-traumatized. And we have to learn to recognize, am I starting to get overwhelmed? And what can I do to self-soothe back to where this is tolerable? So things like the breath. One of my favorite skills is from a acceptance and commitment therapist, Russ Harris, called dropping anchor. And it's learning how to, much like a ship in a harbor when a hurricane comes through, to stay grounded and to stay present until that storm passes. And so the skill really specializes in helping you to kind of hunker down through that trauma activation until it passes while staying grounded. In order to maintain that support system when we are working from home, when we're forced to self-isolate, or just the world is kind of going crazy, we have to stay to ourselves. I think the biggest thing is to make a very conscious and mindful effort to keep those connections alive. When we are by ourselves, especially for people with trauma, we ruminate, we get stuck in it, and we're not able to move through it. And so having people that we can reach out to and consciously make that effort to see in terms of like maybe over Zoom or talking on the phone, or if you're playing video games, having your headset on, talking to people that way, maintaining those relationships, even if you can't meet face to face. I think the other big thing with that too is making a concerted effort in terms of scheduling things. One of the things I remember hearing about during the lockdowns and things like that was scheduling like a Zoom meeting to watch a movie together, or making time to stay connected and stay in contact, even if it's not face to face. Those are kind of the biggest things in terms of maintaining that support system. With the pandemic, not only did we have people who had never struggled with addiction start into that process, but we had so many people who had been sober for years upon years relapse because they lost their social support network. And so I think one of the best tips is, one, being able to reach out and talk to people when you're really struggling, getting that support from the people around you who can help you through it, whether that's your family, people in 12-step groups or other types of support groups like Recovery Dharma, Sobriety, all those different resources, going to meetings, having that connected piece. Another aspect to it too is getting comfortable with having cravings and urges to use. So often we try to teach people to avoid those things, to get rid of those things when they show up. When we have a craving or we have an urge to use, we can learn to sit through it mindfully, to be able to experience that craving and be able to let it pass through us without using. The next time a craving happens, it's easier to deal with. And so as you get further in your recovery, being able to just have a craving without reacting to it or responding to it, just letting it pass is probably one of the best skills. Being able to breathe through a craving instead of this tightening up and this bracing response for when it shows up. One of the better strategies in terms of how to talk about your struggles or reach out to your support network is to be really open and have that direct communication, being able to go, hey, this is what I need in this moment, and can you do that? So often, unfortunately, we try to think people can tell what we need, and people can't do that. We need to be able to clearly state, like, this is my need, and can you accomplish that? And being able to hold space for people to go, maybe I need to teach them a little bit how best they can support me. Some people have kind of a defined support strategy. You got your people who are really good advice givers. You got your listeners. You have these different types of support, and maybe you're seeking out support from somebody that you just want to have listen to you, who's your advice giver. Being able to recognize other people's strengths too and go, oh, I should ask my advice giver person for advice, and be able to help teach people how it is you need support. Tabletop, role-playing games, nerdy kind of stuff, playing video games, board games, all these different things can act as a medium to experience life from a different lens. Particularly things like Dungeons and Dragons, Pathfinder, all these kinds of things. We're able to step outside of our experience and step into this world, one where we don't have that pain, where we don't have that trauma and that hurt, and it gives us a chance to kind of look at it from an outside perspective. The other aspect of tabletop RPG games where it can be used in a therapeutic way, from my understanding, is creating situations where, not necessarily for trauma, but for social anxiety, for depression, for all these different things, creating scenarios and gameplay around learning new skills and tools to be able to practice in this in vivo exposure, this in-life exposure through the game to take to the world outside of the game. So it's a chance to practice these skills in situations that are fantastical and low stake to then take to the world outside of the game and already have that practice with it.